This is a general technique that will be performing in an extension position. Usually a technique done for patients that are more comfortable in an extended position. One of the first techniques we use in the clinic for primary disc-related disorders. So in this case, the patient is side-lying. You need to make sure that there is a line, a continuity going from the shoulder to the heel of the leg on the mat. In this position, you want the side that you treat to be on the sky, not on the mat side. So in this case, I would be treating the left side. The first maneuver that you'll be performing is placing your cupped hand on the greater trochanter and inducing a side bending. So you're going to push the trochanter. In that position, you'll hook the heel of the top leg on the lower leg, and while maintaining this side bending, you'll then induce a rotation. There's almost no pressure with the rotation. The main pressure separation is induced by the caudal hand. Now notice that the direction of the pull will be caudal and slightly anterior, about 30 degrees from a line from the heel to the shoulder. So you're going to go about 30 degrees anteriorly. You need to be sure when you perform the technique that your sacrum is vertical. If your sacrum is not vertical, you're going to end up with the knee on the table, and then you're going to be pulling and mostly pulling the knee into the table. So watch out that the sacrum is vertical. So you maintain that side bending, then rotate. And the technique is done like this, just holding here the shoulder, no pressure, about 2 fingers, and you hold this position and hold it for 40 seconds or longer. If the patient has been improving, because you can repeat this technique 2 or 3 times within the same session, the patient is improving and is getting symptoms usually for no longer than 3 months, you can also do a thrust manipulation. You ask your patient just to take a deep breath in and then breathe out as you are pre-tensioning. And then in that position, you induce a head movement, a little thrust, and you hold that position. Then you don't release immediately the position. You first release the rotation and then the side bending. So this is the side bending technique. If this technique is performed and you plateau during the treatment, there's no more improvement in the symptoms of the patient, or the patient improved, but then he regressed back to where you were, you can also perform this technique with a rotation emphasis. The technique, the first part of the technique is performed exactly as the first technique was performed. So you first perform a side bending, an opening of this left side. So first, side bend by pushing on the greater trochanter, putting the heel, hooking the heel on the bottom leg. Sacrum is vertical. Then you induce the rotation. And then while maintaining this side bending, you're going to rotate your body and rotate your hand 90 degrees from that initial 30 degrees position. And then you're going to pull in a ventral and slightly cranial direction while maintaining the separation. And then As you come back, you can take the hand back to the side bending, take the rotation away, and then take the side bending away. An important point also about this technique, if you treat a female patient that would have a large pelvis might be helped by positioning a towel rolled underneath the lumbar spine to allow the appropriate side bending. In this case, a right side bending. You don't want the patient to go into left side bending.